Hi, I'm Frank Kelly. I'm Professor of Community Health and Policy here at Imperial College London, and I'm privileged to lead a team called the Environmental Research Group who investigate various aspects of the environment on health. I've been investigating air pollution and its links to health for probably over 20 years now. It all started at the University of Southampton, where I was working on a project looking at premature babies and the requirement for extra oxygen because of their immature lungs. So I had a lot of experience of lung disease. But then I moved to London, and I was living across in Westminster and walking across Westminster Bridge into St Thomas's Hospital every day. And I noticed on some days that my lungs were feeling irritated, my airways were feeling irritated. And I realized that this was due to the air pollution in London. So a lot of our early work identified traffic as being a major source of this air pollution, which was infecting people's health. So what was emerging from the tailpipe of petrol and diesel vehicles was these tiny particles and gases, which were entering the lungs and causing inflammation and long-term health effects. We decided that if things were going to improve from an air quality point of view, we needed to somehow control traffic emissions. So this could be done in two ways. It could be done by either improving the vehicle emission itself, and that requires technological improvements, or it could be achieved through reducing the number of vehicles that were coming into the city. So with the GLA in 2003, the congestion charging scheme was introduced, and this was a scheme which basically requested car owners to pay a daily charge if they wanted to come into the city. And it was very successful. It did reduce the number of vehicles that came into the city. But through our air quality monitoring, we quickly realized that it wasn't going to be sufficient. So in due course, another scheme, the low emission zone, was introduced in 2008, and this was an emissions-based system. So the more polluting vehicles had to pay a charge to come into the city. But again, that wasn't even sufficient to solve this air pollution challenge we had. So in 2019, the ultra low emission zone, or the ULEZ, was introduced. And this has been a much more effective policy action. And as a consequence of this, we have a lot cleaner vehicles now entering the city, and we have a lot of improved air quality, which has really been good for people's health, both in the short term and the long term. The fantastic thing that we were able to do, that is ERG, with the GLA, was we were able to run what we call scenarios, where we would say, let's take all the buses and change them from being diesel to being electric. How would that improve air quality in the city? What happens if we ensure that all the taxis change from being diesel to hybrid or to electric? What would we do if we banned the most polluting lorries? So you can do all those scenario testings through different computer runs. And with that information, the GLA was armed to bring in a really effective policy, and that is the ULEZ as we know it.
My name's Shirley Rodriguez. I am Deputy Mayor for Environment and Energy. I work for Sadiq Khan, the Mayor of London, and a long-standing partner with Imperial.
So what were the main challenges associated with the implementation of the ULEZ, the ultra low emission zone in London?
Well, first of all, I start with, air pollution is this toxic crisis that we're facing in London. Over 4,000 premature deaths because of air pollution. It's widely known as an invisible killer, and I think a real problem was actually people not understanding what the impacts of air pollution were, or that it could be solved. And the ultra low emission zone was a key initiative that the Mayor of London decided to bring in when he was elected in 2016. So big challenges were raising awareness of what the impacts were. So we did a lot of research, published a lot of research, some of that with Imperial, to highlight to people the sort of impacts, not only premature deaths, but long-standing illnesses that would then impact on people's lives, daily lives, the economic costs, the cost to the NHS, the cost to the care service, huge numbers that we can probably get into a bit later. And using that evidence base, it was then how do we communicate that to people? So what we did was also a very big marketing communications campaign here. And for those of you who lived in London at that time, you may have seen some of the baby bottle adverts around the network, which talked about if you could see it, you'd want to do something about it, sort of sprinkling of dust to emphasise air pollution. So that was really raising awareness. We did a lot of work with mobilising stakeholders to help us also send the message. So people don't always listen to what the mayor is saying or what local government is saying. So what they want is trusted champions. So people like scientists, academics and so on, but also GPs, but also the local communities. Other aspects, the more technical aspects of about the ultra low emission zone. So having raised awareness, then it was about how do you bring it in. And so it has quite strong transport powers and controls and levers, but we don't control all the roads in London, only 5%. So we have to work in partnership with local authorities who own 95% of the roads. We had to get all the technology in, so camera networks. So we had an existing camera network where we first introduced it in London in 2019, which was around the congestion charging camera network. So that was more straightforward. As a precursor to that, coming in, we introduced a toxicity charge, what we called was a £10 charge on top of the congestion charge in 2017, to act as a signifier and a real signal to people to say this is coming, so get yourselves ready. And the evidence shows that was a really big motivator, a really great tool for engendering behaviour change, and that really helped. So when the eventual zone went in 2019, we could start to see huge increases in compliance. It was around 39% of vehicles complied in 2017 rather, rising to about 69-70%. So, really big jumps. Other challenges were, we had to get a number of people who are more affected, so people with disabilities, people on low income. So the mayor set up a scrappage scheme to help those people.
So given that, what are the costs associated with maintaining something like the ULEZ, and maybe what are the economic benefits for London?
The cost we're thinking about implementation was about 120 to 130 million for the expansion to the inner area. We're now consulting on expanding to outer London, so the borders of London. That's being estimated about 200 million. The ongoing costs of the existing scheme are met by charges. So people who fail to, who drive in with a polluting vehicle and then don't pay the £12.50 charge, they're then fined £160, £80 if they pay within a certain time. And there are still a hardcore of drivers who do that, but the compliance has rocketed up. So we're now over 90% of people driving in that inner London zone are compliant. The net revenues are around the order of about 100 million, and that is all required to be ring fence essentially to be to support active travel, so walking, cycling, schemes to help air quality and so on.
Is there any tangible evidence that air pollution has improved in London as a consequence?
Absolutely. We've published a 6-month-on report and annual reports every 6 months or so on the existing schemes. And we're just about to publish the 6-month-on report from the expansion, and that's looking, just seen some early results and it's looking very good. But the original scheme in central London saw roadside transport emissions cut by 50%, near enough 50%. Huge cuts in PM 2.5 as well. Tens, probably about 50,000 cars coming off the road, no longer, polluting cars that no longer seeing in the zone. So not only is that reducing cars on the road, we have very limited space in London, but it's also helping reduce carbon emissions, which, we see tackling air pollution as also a way of tackling climate change, the climate crisis.
What's next for air quality in London?
Well, we've first got to see if we can expand the ultra low emission zone to Greater London. That is a consultation that's underway at the moment. But the big thing that we are now also consulting on is road user charging, smart road user charging. So we commissioned some research earlier this year to look at how the mayor's target for London to be net zero carbon by 2030 could be met. He brought that forward, his target from 2050 to 2030 in light of, the very serious evidence that we're seeing from IPCC and many others about the impacts, about the pace of change, climate change, the impacts that we're facing, and the evidence that we need to halve global emissions by 2030. Part of that, our big challenge in London is our built environment, and there are air pollution issues there, air quality issues there, but the big area that we wanted to focus on was transport. So what they've identified is we have to cut vehicle kilometres driven by 27% in London in order to help meet that 2030 target. That's the only way you'll do that is through a smart road user charging scheme.
And I've been really impressed by the mayor just hasn't targeted the private car owner. He's also going for public transport as well.
Yeah.
The buses and the taxis.
That's right. So, we had to lead by example, So when people said, well, why are you asking us? What are you doing? That was always a question about what are you doing about your dirty, filthy buses? And look at those taxis. So he asked Transport for London to clean up their 9,000 buses, by 2018, I think, and we did that by the end of December. 9,000 buses, all either Euro 6 or hydrogen or electric, and I think we have the biggest electric fleet outside of China, so the biggest in Western Europe, and that has really cut bus emissions by 97%. So that's made a dramatic difference. We started out with what we call low emission bus zones, targeting the worst routes, and then expanding that. So effectively, London is now a low emission bus zone. Zero emission taxis. So we have, if people remember those really dirty, dieselled, filthy, noisy black cabs, iconic black cabs. So he mandated that no more diesel taxis would be licensed for use in London. So that meant that anybody wanted to drive a taxi in London had to get, an electric taxi or a zero emission capable taxi. That got a company in to create a new style taxi, which you'll have probably seen, absolutely beautiful, silent, really quiet, clean. The drivers love them. Over 5,000 now. Deputy Mayor Shirley Rodriguez, thank you very much for explaining in great detail the challenges in introducing these environmental policies and the reason for doing it and the great success that you've had to date, and we wish you all the success in the future as well. So now I'm going to meet Professor Chris Griffiths. He's Professor of Primary Health Care at Queen Mary, University of London. Hi Chris, thank you very much for coming across to see us today and to talk about the links between air pollution and health and the ULEZ which has been introduced to London. Has the ULEZ so far been of benefit to people who live and work in London?
Well, it's a little bit in early days to say whether or not it's been a benefit in terms of health effects. What we do know is that there have been improvements in air quality since it was introduced, quite dramatic improvements. I think you've heard the data already from a previous speaker, but of the order of 40% or more improvements in roadside nitrogen dioxide. We know that nitrogen dioxide is a driver of health impacts. The work that we did together over the last decade or so in primary school children that showed that there was a negative relationship between air pollution and lung growth in primary school children in East London. Knowing that traffic pollution is harming the growth of children's lungs, that was a major driver to Sadiq Khan to develop a ULEZ that had a big impact on air quality, and that seems to be happening very happily. But what we don't have yet is strong data on those health impacts. That's going to take a little time to gather. We would expect that over the next 5 years there'll be strong data to confirm, hopefully, that health is improving. So one of the big concerns about air pollution generally is that people living in the most polluted areas are those from the most disadvantaged backgrounds. So if you're living in areas with worse air quality, then your health is likely to get worse. The differential between health of advantaged and disadvantaged groups is likely to grow. There's a report commissioned by GLA, Transport for London, and that suggests that there's been good progress in terms of reducing the differential between exposures for disadvantaged and less and advantaged populations. In particular, exposures to nitrogen dioxide have fallen more for those living in deprived, disadvantaged areas by about 50%. So the differential exposure for nitrogen dioxide has fallen by about 50%. So those are good signs. What would we expect to happen if air quality improvements translate into health benefits? We would expect to see improvements across the board. So from adverse health outcomes in birth, childhood, and following through to effects on development of obstructive pulmonary disease, heart attacks, strokes, and dementia, and so forth. Particular effects on growth and development I think are really important to mention. So it's clear that poor air quality harms cognitive development in childhood, and as I've mentioned just now, poor air quality stunts the growth of children's lungs. So we would expect to see improved lung growth in children. We would expect to see improved cognitive development in children into adolescence. These are really important because if children enter adulthood with small lungs, then they're much more at risk of developing major respiratory health problems in adulthood, particularly chronic obstructive pulmonary disease.
And all those things that you've just mentioned about the potential positive benefits of the ULEZ is fantastic from a population health viewpoint. Thank you very much, Chris. That was very, very enlightening.
My pleasure.
As a scientist, it's been actually really satisfying, even gratifying, that to see that the work that the team, the Environmental Research Group, has done has been able to underpin a major policy in a major city. Cities are the future. So more and more people across the globe are moving into cities. The current estimation is roughly 65% of the world's population now live in cities. And as a consequence of that, we need to ensure that our cities have the cleanest air possible, because that's where most people are, that's where most people are going to be exposed to air pollution. Now, London, I think, is a great exemplar of what can be done in a major city. And it's demonstrated that you can, through effective policies, improve the air quality for people who live and work in that city. So I think many other cities have to look to London, as they are currently doing through C40, for example, the mayors collective across up to over 100 cities now, I believe, looking at ways in which they can improve the environment for their citizens in their cities.